Hi, friends, and welcome to the Dr. Green Mom Unfiltered podcast. This is your host, Dr. Ashley Mayer. I feel so honored to have this opportunity to support you and your family on your parenthood journey. Just a note before we begin, if you enjoy this podcast and would like to support my work, please consider subscribing at drgreenmomvip.com. Subscribers have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. As always, I appreciate your support. And now let's begin. Oh my gosh. All right. We are here in another podcast, y'all. I think this is like number 5 for me. I'm on a roll, so I want to keep going. And the last podcast, we talked about the vitamin K at birth. We talked about the vitamin K shot, and we talked about the oral vitamin K and the differences between the two and what is best for your family. And it got us thinking, oh my gosh, we have so much information on a birth plan. So all of the things that parents should be well aware of when they're thinking about what's going to happen with my birth. We are so interested in the colors we're picking out for our room, for our baby, and what is the crib going to look like and what kind of car seat to get. But we don't think about, many of us, and I didn't with my first baby, all of the things that happen at birth and what can we ready ourselves for so that our birth goes hopefully as well as we would hope it to go. So we are going to talk today about a birth plan, and I have Laetitia here talking with me today. She's been working for Dr. Green Mom and Dr. Green Life for how many years, Laetitia?
I want to say 2.
Yeah, I think it's been quite a while. So Laetitia has become quite instrumental for many reasons. She is one of our most fantastic medical writers here at Dr. Green Mom and Dr. Green Life. So if you receive a text message or an email with any type of information from us, it came from Laetitia. And she is also writing so many articles for us and informing parents. So informed consent is the bottom line here at Dr. Green Mom. And she is so well aware of so much. She is a mom of 3 kids now,
3,
right?
Yep.
3 kids. And so she's got so much wisdom, not just in the medical field, but also being a mom herself. So she's had 3 births, and I think 3 very different births, right, Laetitia?
Yes, that's what I was joking about. Almost the full, there's a huge spectrum, but yes, it's always an adventure.
Yeah, and I've had 2 very different births. And so I think this is going to be a fantastic podcast today so that we can discuss all of the things that we think are going to happen, but what maybe might happen, and just so that you guys can have as much information as possible going into your birth. Okay? So Laetitia has put together these beautiful show notes for us. And a lot of what we're going to talk about today is from personal experience. So we are going to give you the medical information, but we're also going to talk to you about how it was for us. And, things don't always go how you want them to go. And quite actually, more than not, things are not going to go as you plan. So in our minds, we have this beautiful birth experience of the baby coming out and mama holding baby, and it's a beautiful experience. But for a lot of us, that's not actually what happens. And so, Laetitia, what about you? Like, what did you think was like the ultimate birth experience? So prior to your first birth, what was that like for you? What was going on in your mind?
Well, I am such a researcher by nature. Which is why I love what I do with you. So I was one of those first-time moms that researched everything. And I had decided I wanted to be at a birth center. And I wanted to be at a birth center so bad, I was actually living in Mexico at the time that I went to Texas.
That's right.
3 months before my baby was born so that I could be at a birth center. And I, had my perfect birth plan with all my hopes and dreams. And yeah, it doesn't always go the way that you plan. So I was at my birth center for like 36 hours, but I ended up with a C-section after that. So it just doesn't, you can have all the planning in the world. And I think a birth plan is necessary. And I think doing your research is necessary, but also having already like the mental preparation that, to expect the unexpected and also do your research. I didn't think I would ever have a C-section. So I didn't research C-sections. It just like, nope, that's not me. I'm going to be at a birth center.
And there is so much to know, yeah, about C-sections as well. And so we don't think about those things. With my daughter, I was going to have a home birth. That's how it was going to happen. And my water broke. And within 24 hours, she did not come. So I headed to the hospital. I did not look into even a hospital to go to. Like
Oh my gosh.
that's how badly and how positive I was that I was having a home birth. And
Yeah.
so I looked at the midwife and I was like, well, then where are we going? And she's like, oh, we're going down to Mesa. We're driving south for a little bit because that's where I know you're going to get the most informed consent. It's not going to be what you want, but that's where I think you're going to get the most informed consent, it was awful. We'll talk about that. So let's talk about what's in a birth plan. These are some of the medical procedures that happen after babe is born. So I want you to understand that when babe is born in a hospital, that babe, there's a lot that happens to the babe in the first 24 hours that you may not be aware of. So I wanted to talk about those different types of procedures. And these aren't emergency procedures that happen. These are procedures that happen to all babes in the hospital. And then obviously, if there's an emergency, more has to happen. But these are procedures that happen to all babes born in a hospital. And we also want to give you some of the other options that are not procedures that you as a parent can do to make this visit at the hospital more palatable, I guess, more comforting. So let's get into this. Laetitia, do you want to start off?
Yeah. I think let's talk about delayed cord clamping. I think that's a big
Mhm.
one. And it's one that has a couple of nuances, maybe. So, what is delayed cord clamping?
And I love that Laetitia did this because everybody talks about delayed cord clamping, but nobody talks about cord milking. So you have options, parents. You have options. If kiddo isn't born the way we hoped, you still have options with delayed cord clamping. And so I'll let Laetitia just talk about just this first part about it, Laetitia, and then I'll just hop in.
Yeah. So, delayed cord clamping is really, as it sounds, it's delaying clamping the cord. And why would we want to do this? It's to allow more of that blood to reach your baby. So, when we say delayed cord clamping, I've experienced at the hospital that the doctor's like, oh, yeah, great, we'll delay by 15 seconds. So sometimes,
You
and I'm like, no, that's not what I meant.
Yeah,
So,
what's really funny is these doctors are not used to parents coming in being informed. So when you
mhm,
go in and you need to have you need to have this paper. Your birth plan needs to be a piece of paper with all of the information on it that you hand to the doctor, not when you're going in for delivery. And so these doctors need you to teach them what you want. So when you
mhm,
say, I want delayed cord clamping, you have to say for how long. In a perfect world, we may want at least 5 minutes. But, like Laetitia just said, a lot of the 15 seconds because they're used to clamping right away, right?
mhm. Yeah, and it might even be muscle memory, right? Like, oh yeah, baby's born, let's clamp. Like you need to remind them like this is what I want. And I think you can also say, until the pulsing stops, I think is also a good way to say it, that you really want to get all that good blood flowing into your baby.
So, what happens after babe is born is that umbilical cord pulsates. So, it is pulsating and it is pushing blood and stem cells and red blood cells and all of the beautiful nutrients that are necessary for babe. It's pulsating and it's like pushing that blood into your baby. And what happens over some time, if as long as you allow it to wait, that cord will stop pulsating and it'll turn really, really white and it'll flatten out once the blood has all of that extra blood has gone into babe. And so that is the best case scenario, is to wait for the umbilical cord to stop pulsating. And here's the reasons why it is so important that we ask for delayed cord clamping as much as possible. It increases iron stores and it reduces anemia risk, so iron deficiency. It stabilizes blood pressure after birth. It supports better neurodevelopment or improved social motor skills by age 4. And it reduces risks for preemies like necrotizing enterocolitis and brain bleeds. So we find it so important that babe gets as much blood as possible. Okay. So tell me, Laetitia, is this what your doctor assumed was 15 seconds?
Yep. Yes. They
It
did.
was this after the C-section?
The
Or was this
C-section, I can't remember. At that point, I
okay?
was not in a wonderful place myself. I had spiked a fever, and I was
Oh
just
my
like,
gosh.
I was not doing well. So no, this was, gosh, I can't even remember if this was with my second son or my 4-year-old.
It all seems to run together as the years go by, doesn't it?
They kind of start to blend, yes. But I want to say that was here in the US. My second son was born in Mexico, and I want to say it was here in the US that I came in prepared with all my things, and they were like, "Oh yeah, we always do that. 15 seconds and then we clamp it." And I'm like, "No, I mean like that blood belongs to my baby. Why would
Absolutely.
we not give it to him?"
Well, so let's talk about that. So there is some research out there, and hospitals are nervous about jaundice. So if you delay cord clamping, you are going to have more red blood cells in your babe. Like that is a fact. And that may increase the likelihood of some jaundice, which means just that your body, babe's body, just hasn't broken down those red blood cells yet because, the liver's still trying to get going and it's trying to get working. And so there's like a yellowing of the skin and you get some buildup of these broken red blood cells. And that's what happens with jaundice is it's bilirubin. So it's the breakdown of these red blood cells build up because the liver, it's just trying to still figure itself out. And so you're going to get pushback. If the doctor doesn't want to delay cord clamping, they're going to say, well, there's a much higher likelihood of jaundice. Well, jaundice is typically, easy to treat. And it's not necessarily like a treatment. It's just that babe's just going to need extra sunlight, photosization. How am I saying that wrong? Typically that's what's going to happen with babe. And so you may get some pushback. So with mine, and we're going to talk about this here in a second, with my firstborn, I thought it was so important that I did this cord blood banking.
They really get you.
Yeah. And yeah, go ahead. Did you,
Yeah,
was this
no,
something?
this was for my first son, and I don't recall having that same kind of all these flyers with my first son about cord blood banking. So many flyers. And I do think there is obviously some potential benefit to it. But I also think they really try to get moms in a vulnerable place and tell you how incredibly life-saving it is. But what are the stats on cord banking?
So I'll say this. I thought I was banking this cord blood if my baby needed it. That's what I thought. So if there's some type of cancer or a blood disease or something, as a doctor, all right, guys, like as a trained medical professional, when I had my firstborn, my daughter, I thought this was so important for my daughter. Well, it turns out this is not typically for that child. It would be for a sibling. So more times than not, which cord blood is minimally used, it's banked, for your child's lifetime if you'd like it to be. But it's typically used for a sibling, not for the child that the blood is banked for. And so in my birth, she told me when I got to the hospital, which was not planned, and they delivered my kid, I so desperately wanted to at least have 60 seconds of delayed cord clamping before she clamped and did the cord blood extraction. And she's like, oh, absolutely not. Like, you want cord blood. We have to clamp the cord right now. And now I know that's not the case.
You can do both.
These are all the things that have to be in your birth plan. Like you have to tell the doctor all of these things up front because chances are quite likely they're not going to follow them unless you are super staunch about it. So you can delay to an extent cord clamping if you want to do cord blood banking. You just can't do it for very long.
Yeah, you have to leave enough for both. So it's a little bit of a trade-off.
Exactly. So I did cord blood banking for my daughter. I did not do it for my son. And so that's where I stand with that. How about you? Did you?
I felt, like I really wanted to for my son. At the time, we didn't go ahead with it. And then my oldest son ended up going through cancer treatment. And then I went back through this mom guilt moment of, should I have saved cord blood? And it turns out it wouldn't have been relevant for his cancer type. And what I was told is that very rarely do they have a use for cord blood in cancer treatment.
Yep.
But I did not. And I went through a guilt of I should have. And then I've also read how you really need to do your research on some of these cord blood banking companies.
Absolutely.
A lot of them, sort of are a little bit opportunistic, I think. So it's a tricky one.
Yeah, so if you do choose to cord blood bank, make sure it's with a reputable company and know why. So have the understanding of what diseases will this treat. So if my child does have XYZ, what will this cord blood be helpful for? Because if Laetitia had been informed, if that cord blood bank would have let her know, or if she would have known, if that would have been helpful for her, she would not have had the mom guilt. God, us with mom guilt,
Right?
Yes. So I'm so glad that you did gain an understanding that cord blood banking would have not been helpful for him with everything that he went through, right? And you as a family. And so just keep in mind, if you choose to bank, just know its limitations and then know its positives too.
And do your research on the company, I think, is really important because they get you with so many flyers. And how do you know which one, right? I think that's...
Yeah. And how do you know who to go with? So that will probably be a question for your doctor because I'm sure that I went with Viacord and well, they're obviously still around. I pay them annually, but they were the only company around 13 years ago. I think there was one other option for me. So that was the only option. And now they're just popping up everywhere. We mentioned delayed cord clamping with C-section. Laetitia, do you want to touch on that?
Yeah. So a lot of, I think the conception is often that you cannot do delayed clamping during a C-section. And that's not true. In the absence of, an emergency where doctors need to be moving quickly, you definitely can. It might not be the full 5+ minutes, depending on how things are going, but you can definitely delay at least somewhat. And if not, there's this really amazing option called milking the cord, where if you don't have 5 minutes, you can still get some of that good cord blood to your baby.
Absolutely. And that typically happens within 20 seconds of birth. And so after the babe is born cesarean, the doctor can milk the umbilical cord to give that extra blood to babe. And research shows how fantastic the outcomes are for preemies. So by doing cord blood milking. So look into that as well. So have that as part of your birth plan. So if delayed cord clamping cannot happen, make sure inside your birth plan you have this option for cord milking because it can happen really fast. The milking of the cord, and then babe can get that extra blood before they have to clamp. So
definitely, yeah.
So keep that in mind. Is there anything else you think about? I think we've really we devoured delayed cord clamping.
Well, I'll ask you one thing. What about with multiples?
So that depends. If there was 2 placentas or 1, right? So you have to be careful if they share a placenta. So that is something you'll definitely want to talk to your doctor about and really get informed on that. because that is probably going to be up to your doctor, actually. You may not have a choice in that.
Yeah, I think, but with multiples that do not share a placenta, it's still an option.
Absolutely. Yeah. So keep that in mind. And you know what? Well, everyone typically knows if they have multiples, because I was going to say, just make sure it's in your birth plan, just in case.
For a surprise, it happens.
It does happen. So it absolutely does happen. There are many parents, there's many women out there who opt not to have, ultrasounds, during their pregnancy. Or if they've just had one in the beginning and you don't always catch that second one or the third one, hiding. So just keep that in mind as well. If you don't choose to do any type of ultrasounds, throughout your pregnancy. Okay, so number 2 on the birth plan, which most parents do not know this happens at birth. They have no idea. And so, 9 times out of 10, this happens to babes right after birth. And parents have no idea what just got put in that baby's eyes. Their eyes are like all goopy and like babe can't see, and then eyes are all glassy. It's antibiotic ointment. And Laetitia, I only knew about the antibiotic ointment. Guys, when I started practicing medicine, I wasn't all about, infants and kids and pregnancy and postpartum. I was in family medicine. And so I didn't deal with births. And so I had no idea. And when the doctors went to take my babe, I was like, what are you doing? They're like, oh, we have to get this eye ointment in your babe's eyes right away. And I was like, for what? And they're like, oh, we just have to make sure that, babe doesn't get any infections in their eye. And then I said, what kind of infections? Like, it was kind of a push-pull. Like, I was holding my baby. They were trying to pull the baby away, and I was pulling back. And then finally she was like, oh, well, this is for STDs. And I was like, well, wait, I don't have any STDs that would be a problem. So it is for gonorrhea and chlamydia.
Quite amazing, right? That they give that to babies universally across the board.
In America.
When it's a simple test on mom.
100% of babies born in the United States, unless otherwise told, are going to receive erythromycin in their eyes. So keep that in mind. We don't have a whole lot to say about erythromycin in the eyes, except say no to it unless you have a diagnosed gonorrhea or chlamydia, and just ask the doctor to test for it. So I think doctors err on the side of CYA, cover your ass, and they want all babies to get it because, say, mom at 37 weeks has a test done and she's gonorrhea and chlamydia negative, but things can happen in the next couple of weeks. And so at birth, they just universally want to put this in all babies' eyes as a just in case. Well, you know what? If you don't feel comfortable and you're not sure, have them test you while you're in labor or a few days prior for this gonorrhea and chlamydia. But you know what? Chances are quite likely, Mama, you're going to know if you're positive for any, well, not any, but most sexually transmitted diseases. If you have an outbreak, you're probably going to know about it. What are the statistics of pregnant women having chlamydia?
So only about 2% of pregnant women have chlamydia, and it's less than 1 that have gonorrhea. And it's a test. Like, it's not like, hey, it's a mystery. Let's, be on the safe side. You can test this. You can know, and you can make an informed decision.
Absolutely. So just keep in mind, do you or don't you want erythromycin in the eyes? And Laetitia, what are some of the problems with the erythromycin in the eyes for babe?
So it's this goop in the eyes. I think we've all seen it in baby pictures, all these beautiful newborns with their goopy eyes. It's in my son's first baby picture because I was coming out of a C-section and I wasn't on top of it. But it blurs their vision. They've got a bunch of goop in their eyes. And, the crawl towards the breast, this amazing crawl that babies do when they're going towards the breast right when they're born, That's why our nipples darken during pregnancy, because babies do use their eyes. And we're filling them with goop, and it does interfere. Maybe not hugely so, but it does interfere. And it's an antibiotic. And as we know, all antibiotics have an effect on the microbiome.
Now you just got this brand new sterile baby coming out, and then now, they've got to figure out, their bodies have to figure out this microbiome, and all of a sudden there's like slapping this antibiotic in their eyes. So yeah, one, they can't see. And, the idea that, gazing into your mom's eyes at birth is so important for connection and being able to find mom's breast, right? And on top of that, it's, killing all the good stuff that you got with your microbiome. So keep that in mind. And you know what? All antibiotics come with risks, right? So now you're increasing the risk of something.
And I think it must be uncomfortable. I mean, I imagine a bunch of eye ointment in my eyes, and it doesn't feel nice. Even just plain old eye drops don't feel nice.
Absolutely. So there is a chance for allergic reaction and chemical conjunctivitis. So it's an inflammation of the eye due to a chemical. It's what they call. So due to possible antibiotic. And so, yes, you can absolutely decline this. This isn't, state mandated, although they may tell you that it is, right? They tell you everything is, the law when you're going through birth, all of the things that have to happen. And so you can absolutely decline this. So just make sure it's in your birth plan, that you want tested if you're not sure. And like Laetitia said, it's a test. It's not like an unknown that you do or do not have an STD. So yeah, that's all we got to say about that, right?
Yeah, and let them know, because it happens quick. As soon as baby comes out, they're popping that on them. So make sure they know.
Well, yes, just because that's what they birth all day long. You got the nurses in there, you got the doctors in there, or whoever's in there helping, physician's assistants, nurse practitioners, and everyone's just doing what they're robotically been trained to do. And so unless you are very adamant about what you do and don't want, they'll just go on about their day. And
they're following procedure, right? Like, I think doctors and nurses are absolutely amazing, but they're following their procedure. They're doing their job.
Yeah, it's hospital policy.
So we need to just speak up and make it clear, and make sure that your spouse, your birth partner, your mom, your doula, whoever you have there supporting you, make sure they know as well. Because if you're like me and you're kind of out of it after a kind of crazy birth, you need someone else advocating.
Absolutely. So what I recommend to parents is they make 10 copies of their birth plan, and their doctor and their partner and their doula or midwife, whoever you have, they all receive this birth plan before 36 weeks. So they all have a copy of it. And then make sure you have another. So they all get a birth plan copy. And then when you're in labor or prior to, you have all these copies that the hospital gets, all of the nurses who are in the room get, the doctor receives, everybody gets your birth plan. So keep that in mind. You don't make one copy and take it to the hospital, because it's very easy for a healthcare professional to not see that document because it's somewhere else. It was given to somebody else. So just keep that in mind. Okay, so this next one is typically state mandated. Actually, I know it is, unless you're at home and give birth and then you don't do this. But I wanted to include this in your birth plan because you actually can have options. So this is the infant heel stick. So this is the newborn blood spot test. Now, Laetitia, I thought your kiddo was born in Mexico. He was born in the States, because I was going to ask you if they do that in Mexico.
Well, one of my children was born in Mexico.
Okay. I knew that.
Yes. My first son, I moved to Mexico pregnant with him, which, by the way, pregnancy and tummy problems and moving to Mexico was for me, that was rough.
Oh my gosh.
I was not used to, you have to adapt to new bacteria. So that was rough. But no, so I did the second half of my pregnancy in Mexico, got prenatal care in Mexico. But then I was like, I don't want to do this here. I want a birth center. I had all my plans. So we went to the States, or I did. And then my husband came and joined me closer to the due date and had him here at a birth center. My second son, at that point, I knew Mexico a little bit better. I spoke Spanish, and I had him in Mexico, which was actually really interesting because this time around I was at this private, like bougie hospital, kind of like a med spa,
Really?
like for birthing. That just the kind of thing that doesn't exist in the US. And, I had my OB's WhatsApp number, and it was like they have an acupuncturist on staff.
What?
Yes.
Oh, that's fantastic. So did they do a heel stick? Is that necessary in Mexico?
I don't know if it's mandated,
Okay.
but at my fancy bougie hospital, they did. And my second son he was hospitalized. He was in the NICU for a week after that. So he had all the testing done. So yeah, when I say I've had the sort of the full,
The full gamut.
all the experiences, I really have. So yes, but I can't say, I don't know if that's standardized for everyone.
So here in the United States, the heel stick, which is a blood spot test. So what happens is that the doctor or the nurse or whoever on the first day of life, typically between 24 and 48 hours after birth, they prick your kiddo's heel with a needle, and then they take out, they squeeze the blood out of the heel, and they go along this white card and they do this blood spot, and then they send it off for testing. So what it tests is a wide array of possible genetic diseases, lysosomal storage diseases. It tests for autoimmune diseases. So there's multiple different markers that are tested. So it's typically between like 30 and 50 different disorders that this tests for. Now, back when my daughter was born, there was just one heel stick option. So you just got one single heel stick. It happened first or second day of life. And then the test got sent off to the state, and it came back, if babe was positive for any of these disorders. What Laetitia had put in the show notes, and I looked at the show notes this morning and I was like, oh my gosh, yes, is that if it comes up positive that your kid has any of these disorders, it is not a high likelihood, but there is a likelihood for false positives, meaning babe doesn't actually have this disorder. So they'll retest. So if anything ever comes back positive, historically, they'll retest to make sure that that is for sure a positive result. Now, that was when my daughter was born, and that was 13 years ago. And I did the heel stick. And I think everyone should do the heel stick. I'm not saying this is like an option for you. I think it's very important that everybody does the heel stick. But why we included this in our birth plan and why I talk about this is because I am a carrier for Niemann-Pick's disease. And here in the state of Arizona, that is not one of the diseases or disorders that are tested on the Arizona heel stick. And so I actually opted for what's called the PerkinElmer newborn screening. And that covers like 30% more disorders than the Arizona heel stick. And the difference between the two as well is that, as Laetitia had put here in the notes, the false positives, what happened was within the last several years in Arizona, and I'm not sure about every state, but I believe it to be true, it's now a 2 heel stick. So you have to get the first heel stick between 24 and 48 hours and the second heel stick between 5 and 10 days. So now you have to get 2 heel sticks here in Arizona, and the PerkinElmer is just one. Now, obviously, if that comes back positive, you'll want to retest. But the PerkinElmer was just one, and the state allowed that. The state allowed the PerkinElmer for here in Arizona. So it's just an option for you guys to look into. But this is typically not very invasive. It is a heel stick. So it's just one more trauma to babe at birth, right, Laetitia? There's
Yes.
multiple. So reduce the amount as much as possible.
But breastfeeding really helps, or holding baby skin to skin really helps. And I know we feel so protective of our fresh little babies, and it feels so counterintuitive to have them be poked.
All of this to be done. I'll tell you I had the PerkinElmer done on day 3. So day 3 of my son's birth, the midwife was amazing. I was in her office and she's like, make sure you nurse him. So I was nursing my son And while I was nursing him, she did the heel prick. And it was beautiful. I mean, okay, the heel prick was awful, but it was beautiful because he kept nursing. He felt it. And he arched a
Mhm.
little bit, but he stayed on my breast and he just continued feeding. And that was it. So
Yeah.
all that fear of having to have my baby pricked, and me too, like I had all that fear just, 6 years ago, even though, I've been in private practice and I know I do sticks all the time. I'm poking little babies, drawing their blood and doing IVs. And I too was very nervous. So I love that Laetitia mentioned.
The little heating pads that you can hold up against their heel right before. I
Yes.
think if they don't automatically offer that, which I think many do, ask for it because it does help. It just makes the blood flow a little easier so they're not milking, pushing that blood out and bothering them more.
I like that you said that because that wasn't an option for me. And I didn't even know that back then. But she did let me know she might have to stick twice, depending on how much blood she was able to milk out of the heel with just that one stick. So having that, small heating pad is fantastic, is a fantastic option. And so, yeah, there could be some discomfort and some bruising at the site, but this is a really important test. I will tell you, I'm so blessed to have access to so many thousands of parents having, started Dr. Green Mom over the years. And I have just access to so many of you, and so many of you have shared your stories. And the heel stick is life saving. So for so many parents I've had conversations with, this heel stick is life saving. What are some of the stresses, Laetitia, that parents have about getting all of this information and handing it over to the state?
I think that is
Mm-hmm.
a concern for many. And it is true that in some states they can store this blood, and supposedly they do so anonymously,
Mm-hmm.
and they can use it for research.
Yes.
But we're not always really given, being informed of this, and we're not really explicitly giving consent to this.
Mm-hmm.
So that I think that is a concern that parents have. Me personally, as a medical mom, for me, the want to know and to test matters to me a lot. And I think if my son's blood is truly anonymously being used for research and can help another baby down the road, I'm also all for that. But I do understand the concern.
Well, I have had no informed consent. And what is my baby's blood being used for?
Exactly.
So parents just really want hey, tell me what you're doing. Like, inform me so I can make an educated decision. When parents are held in the dark, it's typically when they push back.
Exactly. It feels scary.
Hmm. If a parent's not told your kid is getting all of these things done to them at birth, if you don't know, that's when parents stress out. So if you're fully informed, it just makes it easier for everybody.
Agree. And I think it's important to note as well that you can request, at least in most states, I don't dare say for sure if it's across the board, but you can request that your child's sample is destroyed after they test with it.
You have to request it. Like, you absolutely explicitly, you have to have that on the paperwork. And, you're in the hospital and the hospital is doing all the paperwork for you. So unless you are explicitly saying, hey, when you send that sample off after they're done with it, it needs to be destroyed, it's not going to be. So just keep that in mind as well. But you do have that option I know you have that option in Arizona. I just, I don't know about all the states.
Something worth noting in your birth plan and maybe putting your birth partner in charge of.
And I was going to say, I feel like parents need a legal team now to be able to figure out the
It's
statutes in every
true.
state, the laws in every state for birth, because I get a lot of questions from parents like, will CPS be called if I say no to XYZ at birth? Because some states, some doctors will call CPS for the most mundane things.
Which is terrifying.
Mm-hmm. I'm refusing the vitamin K shot at birth, and I want to do the oral. And there are some medical establishments that may, like in the state of New York, they may fearmonger you that they are going to get CPS involved. And so I That's another thing, is fear mongering for parents, when they make these decisions or they're trying to make the most informed decisions. So anyway, that was a tangent. Speaking of vitamin K, we're not talking about it today. It is part of your birth plan. The podcast that we recorded just recently was all about vitamin K. So although we're not talking about vitamin K today, just know that listen to or watch the podcast that I just did.
It deserved an episode of its own.
Yes, vitamin K deserved an episode of its own for just so many reasons. Okay, so number 4 is the hepatitis B vaccine at birth. A lot of parents don't know that this happens. So keep in mind that we talk about this last, I think. I should probably just say this now. Let's just chat this now. Do not let baby out of your sight. I think that's number 8 that we were talking about today. We should have made it number 1. So do not allow baby to be out of your sight or your partner's sight through the entire process in the hospital. And I'll tell you, if you do a quick Google search, there are litigations across the country where healthcare professionals you've given your birth plan, you've stated your wishes on exactly what you want to happen. The nurse went ahead and gave the Hep B shot anyway. The vitamin K shot ended up happening without your approval. Even after you said, I don't want this to happen, there was a nurse who was giving Hep B shots to every baby born, even if the parents said absolutely no to it, because she said it was in the baby's best interest. So there are procedures that can happen to your baby if you are not there. So make sure someone is with your baby at all times. And that's all I have to say about that. Do you have anything to say about that?
I think you said it great.
I think just do not let them out of your sight. Parents have asked me that on the birth plan information that I give out. Well, why? Well, that's why. Because procedures happen when you're not looking. Okay, so hepatitis B at birth. This is a vaccine that's given at birth. Some hospitals just have the pediatrician do this first shot at the 1-month exam, but most will still do this the day or the day after of birth. Laetitia, you want to take this one?
Yeah. So the hepatitis B vaccine makes me think a little bit of what we said with the eye ointment, because you can test. So how would a baby be at risk of hepatitis B? It's if the mother is positive, or if they're going to be having household contact with the bodily fluids of an infected person. So if we can test the mother and we know that the mother does not have hepatitis B, and this is not something that your baby is going to pick up, when they're 6 months old at playgroup. This is something that you pick up by sharing, bodily fluids with an infected person. Then why are we vaccinating at birth when baby is 1 day old universally to all the babies across the board? So that is a question worth asking.
Absolutely. And if mom is Hep B positive or caregiver is Hep B positive, that is a conversation to have with your doctor. But the statistics are very, very, very low, and I don't think we have those, that one of the parents are Hep B positive or a caretaker. It's very, very low statistically. And if you don't know, get tested. Get tested, mama, while you're pregnant. Dad, get tested, or whoever the caregiver is going to be. But this is not something you need to vaccinate for on the first day of life. For 99%, I'm going to throw that out there. I don't even know if that's true, but it's probably that. 99% of individuals or babes who are born probably don't need the hepatitis B vaccine. It's just such a small percentage. Could be, a few percent. But anyways, again, it's something you can test for. It's not like we don't know that you're Hep B positive. So get tested for it. And if it's negative, my medical opinion and my personal opinion is this is not something that needs to happen when you're trying to get comfortable with your babe. When babe is trying to learn you and you're trying to learn babe just came out. The least invasive amount of procedures that have to happen, let's limit those to the max. It's like, as an example, I said the heel stick. I did it on day 3 of life because I just wanted to limit the amount of trauma that happens to my babe in the first day of life. I just wanted to use that to cuddle and snuggle and nurse and, allow all to be right with the world as much as possible.
Yeah. And I think if you're, everything is overwhelming right when you've given birth to your baby and they're asking you about the hepatitis B shot, I think in that moment, if you're not ready to say, no, we're not vaccinating or, make a big statement like that, you can say, oh, we prefer to do it with our pediatrician at our checkup. Just
Yeah.
push it a little bit. Give yourself a little bit of time. It doesn't have to be in those first moments after giving birth. And normally when you say, oh, we're going to do it with our pediatrician, they'll leave it at that. Then they're not going to argue with you. So that's an easy line.
And whether you do it at your 1 month appointment doesn't matter. It's just that that's what you tell the hospital is that, hey, I'm doing this at the 1 month appointment. And then when you get home and decide, what you want to do after that.
But then you can have that discussion with your pediatrician when you're not fresh out of giving birth and your emotions are, way high and you haven't slept, and you just give yourself a little bit of time.
And all of that's going to happen at your birth. You are going to be exhausted. You're going to have all of these amazing high emotions, low emotions. You're just going to not be feeling quite like yourself to be making decisions. So just postpone. And what are some of the reasons that, parents need to be informed about regarding the hepatitis B vaccine? I talk vaccines to death, but most people who follow know this information, but I still like to continue to reiterate, what are the reasons that parents may be concerned about the Hep B vaccine?
I think ingredients is number one. I mean, there's ingredients in there that we might not want our 1-day-old babies getting just yet or at all. There's aluminum, there's yeast proteins, there's even formaldehyde, so do your research on the ingredients. We actually have a great blog post about it on drgreenmom.com.
Yes, we do.
And then there's autoimmune concerns.
Mm-hmm.
So there's a study.
A plethora of research.
Yeah. There's one that I wrote down on here. It's from, the late 1990s, but it was shown that hepatitis B vaccination could trigger the onset of an underlying inflammatory or autoimmune rheumatic disease. So it could be the trigger. And there's multiple. I've got a couple points on here. Here's one that the hepatitis B vaccine significantly, a more than twofold increase in the risk of developing systemic lupus, erythematosus. You're going to have to say that for me because, geez.
Erythematous. Yep. So keep in mind what a vaccine does. It is to stimulate an immune response. That is the whole point of a vaccine. So I'll leave it at that, is that its job is to stimulate immune response. And I think that's fantastic. But to some, it may trigger autoimmune. So that is some research that's been done in the past. I love studies from back in the day. I absolutely do. I love research from years ago. I love the up-to-date research, but just because it's from a while ago doesn't mean that it's not sound, right? Mm-hmm. And I hate to think this, but I feel like research from the longer ago is less likely to have any hands in the jar. So.
Yeah, well, it's interesting because the CDC denies that vaccines can cause autoimmune disease. So
that's the point I'm trying to make. Thanks, Laetitia.
Mm-hmm. Yes.
Is that some of the older research I find is more firmly in the science and less about what other agencies or organizations are trying to say. How's that?
Yep.
Okay. Do we have anything else? So the hepatitis B vaccine can absolutely be declined or delayed. This is not something that CPS will be called for. So keep that in mind, but definitely put it in your birth plan. Make sure babe stays with you or partner at all times after you do say, this is what I do or don't want for my kid, so that the Hep B vaccine doesn't happen to be given without your consent.
Mm-hmm. Because if you don't say otherwise, they will just do it as standard procedure.
Standard procedure, they will just do it. And so all of that paperwork that you sign that you don't actually read, it's in there. So everything that you sign when you're going into a hospital or hospital standard procedures is, hey, I've opted to come into this hospital, and then that hospital has standard procedures, and those are the ones you abide by, unless you opt out. Okay, what's the next one, Laetitia?
Let's talk about skin to skin and
Oh,
breastfeeding.
yes. How is that for you? Do you have any good stories or sad stories or?
This is what we all like. This is what we do it for, right? To have our baby on our chest at the end of it. That's why they call it the golden hour. So I do have my personal story with it. So my first son, I already told that story a little bit, how I had this huge drawn out birth center experience that eventually, very quickly went downhill, and I wasn't doing well and ended up being a C-section. And I wasn't like, I was burning up. So they needed to take care of me after they got baby out. But thankfully, we had said, well, baby is never alone. So my husband was doing skin to skin with him as soon as he was born, which was really nice. But I didn't get that. And that was a loss for me. I didn't get to have my baby on my chest. I fell asleep. Like, I passed out as they were stitching me up and woke up a little while later. So I didn't get that, and that was a loss and something that I was really sad about. And then when my second son was born, this was at this bougie hospital in Mexico, and he came just before 36 weeks. He was 35.6. They induced him because my boys are only 19 months apart, and I had a C-section before. And I went into my routine appointment, and they started freaking out. They did an ultrasound, thought I was at risk of uterine rupture. So it was still a vaginal birth. This amazing, cool hospital, they induced me with acupuncture. It's amazing. They were like, we've got to get your baby out today.
Oh,
Don't
my
worry. We'll bring
goodness.
over an acupuncturist, go into this room. She did her thing. They put a cream on my arm, which I still don't know what it was. I have to think it was some kind of topical Pitocin type of something. But the combination was all it was. And then they wanted me hooked up to an epidural, but they didn't turn it on. They just wanted like a super light drip just in case. Anyway, so I was still able to move around, and I had a great birthing experience with him, but he was a little premature. And when he came out, he wasn't doing so great. So I had him on my chest for like a couple seconds, and then they took him to, fix him up a little, and he was in the NICU for a week. So I didn't get that with him either. And then finally, my third boy. Third one was the charm. I got to have him on my chest after he was born, and that was really amazing. So, but I will say it's really important to know that skin to skin is still beneficial, even if it's not the second baby pops out. It's beneficial all through infancy.
Absolutely. I love women sharing their birth stories on what they were and weren't able to achieve, or the loss or the triumph of all of it. Same thing with me with my first child. She was born, and they took her and they used all the suctioning, and they were just doing all of these things, and they had other doctors come in the room, and nobody told me what was going on. I said that I didn't want the vernix rubbed off, and they wrapped her up in a blanket, and they were like scrubbing her, and then they took her to get weighed. I mean, all of these interventions that were happening right in front of my face. And I kept saying, no, I want my baby. And they're like, I'm sorry, this is standard procedure. We have to do this. And
That's so sad.
I just laid there like, what are you doing to her? Like, she is supposed to be with me right now. And it was great, like you say, that, skin to skin is great to happen at any time. But, the idea, after we have our babe, is that, the babe gets plopped up on our chest, like as soon as babe comes out, and that's what we all dream of. And so keep in mind that you have to advocate so strongly for that. You have to advocate so strongly for the skin to skin to be able to happen right away. They have to know, do not weigh my baby. Do not put the eye drops in. Do not suction my babe unless it's absolutely necessary. Typically, babes are able to suction up themselves. So instead of it having to be all these procedures that happen, anyway.
Is there any medical reason why they might have to weigh baby instantly upon being born?
What do you think? No,
I think no, but I just wanted you to say it.
Yeah. I like, If babe's coming out small and in distress, you
Mm-hmm.
obviously know babe is small and weighing not enough, right?
Mm-hmm.
So the
Mm-hmm.
idea that you have to weigh the baby, like that's just ludicrous to me. And it's a cold, cold metal
Yeah.
surface that they stuck
Mm-hmm.
her on. And I was like, you guys just absolutely suck.
There's no need. It can happen later.
Yeah. So, yes, skin to skin and always through infancy is just absolutely beautiful. My second birth, we had a home birth. Letitia, it's like everybody's dream birth was what happened with my second birth.
Oh, that's so great.
It was my midwife, let me just say, just absolutely unbelievable. I had the baby plop on the chest. Like, I didn't realize that he really needed to be rubbed vigorously to like get him going because he did
Mm-hmm.
have the cord around him. And I just remember my midwife being like, "You got to talk to him. Like, you got to move him around. Like, you got to get him going."
Aw.
And I did, and then he was good to go. So keep that in mind that you really have to advocate strongly for the skin to skin. And breastfeeding. How did you do with breastfeeding, Letitia?
So, again, I feel like I've had this large spectrum
Hmm.
of breastfeeding experiences. My first son, I was one of those lucky moms, especially being a first time mom, that it just came easy.
Oh God, that's
It
just
was
incredible.
never an issue. It just came easy and it was great. And then, my second son, who was born a little bit early and he was in the NICU for a week. And I was trying to pump and I was bringing him milk and they would let me feed him every 3 hours only, like at feeding time.
Oh gosh.
We would try and then we would give him a bottle after and, the whole thing that happens when babies are hospitalized. And then he just didn't have a very strong sucking reflex. So it took a little bit of time. I'd sometimes have to like massage his cheeks and kind of help him remember what to do. But then he got it. He was in the hospital for a week. And then I would say maybe a week or two at home that it was kind of rough. And then he got it. And I also ended up having really quite an easy breastfeeding experience. And so when my third son came along, I was like, oh, I'm a pro,
I'm ready for everything.
yeah, like, oh, I've breastfed two kids. Like, just pop them on the boob and like it'll be fine. And it was so hard.
Really?
So he was born right at 40 weeks. They induced me with him because this was in the US now. And because it was a VBAC, even though I'd already had a VBAC, they didn't want me to go past 40 weeks. And so we had an induction scheduled for the day I turned 40 weeks. But, he came out great. He was like 96th percentile, I think 98th. He was, big, healthy baby. And he seemed to be breastfeeding all right. But he very quickly started dropping weight. He went all the way down to 5th percentile, just started dropping weight like crazy. He was jaundiced. We couldn't get the jaundice to go away. So they need that, they need to be moving through their digestive system, all that milk to get the
Mhm.
jaundice moving. And he just wasn't getting enough milk. And it took us quite a while. They thought all these horrible things were wrong. And we did all these tests on him. And I kept saying, as moms often know best, I kept saying, hey, I think he's tongue tied or lip tied. Like, I think he's not feeding effectively. And they were telling me no, and he's not. And, we think he might have kidney disease. We did an ultrasound, just all these things. And meanwhile, he's dropping weight like crazy. He's in the Billy blanket all day long. I mean, just not doing well. And eventually I was like, you know what? I think this is what it is. And so I went on the mom groups and I found the best lactation consultant in my area. And she was my savior. And she was like, oh no, he's so tied. And, we did the different body work. We got it released. We had to do the stretches, but it was still a really long road. It was a full almost 4 months of triple feeding, of doing oral exercises, of doing feeding therapy and pumping, through the night. I was pumping at school drop off with my older kids, pumping while I was driving. I was thinking about it the other day. I was talking to a friend. Part of the reason why I think I was able to stick to this really hard triple feeding plan, I was weighing him before and after every feed. Like, it was so intense,
Oh my gosh.
was because I knew what was on the other side. I was like, if I can get through this and we can get him fully on the breast, I know how great it is. So it was worth it for me to get him there. And we just kept trying. And eventually I did get him fully on the breast. But yeah, I was supplementing with formula here and there. I was pumping, I was bottle feeding, I was breastfeeding. Just, it was all consuming. And I had 2 other kids.
But you knew, because you've had 2 kids prior,
Exactly.
yep, that you breastfed, so you knew how beautifully experience can be.
Exactly. So that helped me.
Absolutely. I want parents to know that, yes, fed is best, but when it comes to your immune system and everything you're giving to your child, breastfeeding is going to be the best possible outcome to feed your baby. People ask regularly about vaccinating. If you are breastfeeding, you have many more options when it comes to, what vaccines do you want to do, delay, not do, and you can feel a heck of a lot better about it if you are breastfeeding. Breastfeeding is it's giving your baby everything that it needs. I'll tell you, although it can happen, having to try to figure out a formula for your babe is exhausting.
It's also hard.
It's absolutely hard and exhausting. So keep that in mind, that there's benefits to really just continuing with a fantastic lactation consultant. Make sure you have one in your birth plan. Make sure you know who you're going to turn to if babe's not feeding well, because your best bet is breastfeeding, even though it can be hard. When my daughter was born, I thought I knew exactly how to breastfeed. You just stick baby on the boob. It was probably a month into it. Both of my nipples were just absolutely chewed off. I was trying to sit up straight and it was awful. It was the worst experience of my life besides the birth. Just trying to get my daughter, same situation, trying to get her to latch correctly. She had lost an incredible amount of weight. My family was like, oh, she looks like Skeletor. And I'm like, oh, this is not good. So same thing happened with her, is that, as much as I thought I knew, she wasn't feeding correctly. And so get a lactation consultant on board. Some hospitals have really great lactation consultants, but chances are quite likely you're going to need help after you leave the hospital or after you leave the birthing center. So just keep that in mind and have one in mind just in case. And a lot of them do home visits. So I want to plug that, and I want you to know that there is support out there if you need it. My son, when he came, he nursed like a champ right away, no problems. It was a beautiful experience. But my firstborn, it was very troublesome. So I hope what you're getting out of this today, between Laetitia and I speaking, is that you never know what's going to happen. You never know what's going to happen. So just be prepared. Have all of this information in your birth plan and simply be prepared. Okay. Let's talk about baby's first bath. Laetitia, did your babes get baths right away?
My first son did. My first son pretty much got all the in-hospital things because...
You're struggling.
Yeah. And so they just did what they did. They did the standard procedures. But what blows my mind is the Johnson & Johnson baby wash. I have it in here with exclamation marks, because it's just kills me. It just kills me.
I don't know how Johnson & Johnson has not had a class action lawsuit with the parabens and the just disaster ingredients that have always, and gee, the smell. I know a Johnson & Johnson baby wash smell from 2 miles away. It's traumatic for me to smell it. I'll say that, so vernix, your babe is born and typically has this white substance all over its body. If your babe didn't have that, because a lot of parents will comment, well, oh my gosh, my babe was born and it didn't have any vernix, is that okay? It's this cottage cheesy white stuff that's all over babe. And it's so fantastic. And it's got all of this beautiful proteins and antimicrobials. And it's just this fantastic wax that if you let it sit after babe's born, it melts like coconut oil into their skin. and it melts rather quickly and goes away. So do not rub that off. That is like a beautiful barrier of babe that needs to soak in. And if babe's born without it, it probably means they cooked a little longer. So babes who are born earlier, so, in the 36, 37, 38 week, they'll have more vernix typically. And if they're born, at term, 39, 40, 41, they will typically have less vernix. But don't rub that off. Like, absolutely leave that, let it soak in. So that, again, has to be in your birth plan. Do not take a blanket and rub that stuff off. Put babe on my chest and let that soak in. When it came to bathing, again, I'm going to reiterate, do not leave baby out of your sight. Baby does not need a bath. Absolutely no, 100%, baby does not need a bath. They do not need that vernix washed off now that it just soaked in. And so for both of my kids, I want to say it was 3 weeks before I actually put them in one of those silly plastic tubs to give them a bath. And I just, use a wet cloth to wipe them down.
Same with my other boys, yeah. They don't even really need much more than water for their first bath,
Mm-hmm. Well, so I'll say this. I formulated infant and kid body wash and infant and kid lotion, and I sell it, full disclosure. But my kids, neither of them used baby wash. Like, there's so much chlorine in your bathtub that my kids, until they were 2 years old, I didn't use anything on them. I just put them in the water, and that was all I did. So, that's an option for you parents.
You'll notice when your kid starts needing, when they start rubbing, their food in their hair, the spaghetti sauce, you'll notice.
You're like, all right, I do need to use some type of soap on my kid.
The time comes.
Yeah. If your kids are playing outside and they're in the dirt, yes, okay. So maybe use a little soap, but just keep in mind, like, most soaps are harsh. And so back to the first bath, I don't recommend it. I absolutely do not ever recommend a bath in the hospital. 0. And let that vernix, let that waxy coating suck up all into babe's amazing skin. It's such a protective barrier. It's so beautiful for them.
And it smells like mom, right? That's another amazing benefit. It smells like, where they come from versus smelling like perfume, Johnson & Johnson baby wash. Baby senses are so important.
And we don't, there's so much that happens in the hospital on that first day with a newborn. It's as if we are not paying attention to what's the best for the newborn. Like, the best for newborn, best for babe is to be with mom, is to be skin to skin with mom or dad. Like, that's what's best for babe. But what's best for the hospital? What's best for CYA? What's cover your ass? What's best for the doctors or the nurses? Like, oh, I have to get to my next appointment, or I have to get to the next room. Like, that's what they're thinking about. So you have to advocate so strongly, for your babe.
Definitely.
And I think, is this the last one? Oh my gosh, we're getting into the last one, guys. So hang with us. The last one is the infant hearing test, which I think is important. But you do have options. So this isn't something that babe has to get done like right away. Laetitia, did you have the hearing test done in the hospitals, the birthing centers?
I did. I've had that with all my babies. Yeah.
With my firstborn, they wanted to take her and go do the hearing test. And they kept coming in and bothering me. And I just remember being like, leave me alone. Like, just leave me alone. The pediatrician came in to do the 1-day exam. I remember I discharged myself after 15 hours and the babe against hospital's wishes. I'll just say that. It was atrocious. But the pediatrician came in and said he was there for the 1-day exam. And I said, can I just do the exam? I'm a doctor. Can I just do the exam on my babe? And he's like, oh, absolutely. So he walked out. I did get a bill for it. I got billed for the 1-day exam that the pediatrician never did.
For the exam you did yourself?
Yeah. I was just so tired of them coming in constantly.
Yeah.
So they came in, probably 8 times in the 15 hours saying, we have got to do this hearing test. It's hospital policy. And I was like, no, it's not happening. Like, I'm not doing it right now. Like, you guys have poked and prodded me every 15 minutes with my blood pressure. and constant checking on the baby. And at one point in time, I had the baby in the bed with me and we were sleeping, and they came in and they like took the babe and put it back in its bucket while I was sleeping.
I've been there too, yeah. They're like, you can't have your baby in bed with you.
You can't sleep with your babe. I was just like, oh my God, you guys are absolute nuts. So I kept declining this hearing test. And then finally, the last nurse came in and she's like, look, I would really love to be able to get this done. Is there a way that we can get this done where we're mutually satisfied? I said, yeah, I'll go with you. And I wasn't in a place to get up the first 12 hours after birth. I was just exhausted. And so finally I was like, I'm going to go with you. So I picked up my baby and I went to walk down the hall for the hearing test. And she's like, oh no, you can't carry your baby.
Oh my
I was
gosh.
like, are you kidding me? They're like, it's hospital policy.
You're going to send me home and I'm going to carry my baby.
While you're in the hospital, babe has to be in their bucket, like this push bucket thing. You know, I'm talking about the plastic thing that sits next to the bed.
The little bassinet on wheels. Yeah.
Yeah. So I had to wheel her down the hallway to get this, hearing test because it's just so almighty important for the hospital to get this done. So that was a traumatic experience for me. But with my second, again, reiterate, do not let your child out of your sight. Either you or your partner or your mom or whoever's there at the hospital with you can go to the hearing test. Just make sure they're not by themselves. Do not get the bath by themselves if you opt to. Have a partner with you. I can't reiterate that enough. But with my son, I went in and had the hearing test done at the 1-week exam. So my midwife did the hearing test. And all was right with the world. I want to say it was like day 3, I guess. It wasn't like the 1-week exam. It was probably day 3 when I had that PerkinElmer heel stick done. So she also did it. And then she repeated it. So she repeated it probably at 2 weeks after he was born. So you have options with the hearing test. And you can absolutely say the pediatrician is going to do this at the 3-day visit or whatever you schedule your visit for.
So little of this is like emergency care. It can all happen with time, with peace, when you're ready.
Yeah. So my recommendation is to talk to other women who have had babies. What was your experience? Talking about the birth experience so that you have an idea of all of the different procedures, all of the different things that can happen that can go awry, all the triumphs, all the greatness that can happen, so that you're well aware. Because just because you have a birth plan, just because you have this information, does not mean that your birth is going to go as you expect, obviously. So Laetitia and I, between both of us, have had 5 kids, and all 5 of those births were exponentially different. That's how it happens, right? Like,
it's true. Be prepared, but also be prepared for all the scenarios. I was not prepared for the hospital scenario. I was only prepared for the birth center scenario. Be prepared for all the scenarios so that if things do go a different way, you still feel informed. You still feel like you have some control. You can still say what you want. And it's just, for yourself, it feels better, and you're going to have the outcome that you hope for within the circumstances.
Absolutely. I had a midwife with both of my pregnancies, different midwives. I want to plug Mary Henderson. She's my midwife with my second. She still practices here in Arizona. She's in Phoenix. So it's Mary Henderson. She is the biggest badass in the midwife industry, I think. So I just want to say that. But what I'll say is that with my first midwife, I didn't have a doctor as a just in case backup, like if things did not go right during my home birth.
Neither did I.
And that was when I was like, oh my gosh, I don't even know what hospital we're going to. Like, where are we going? So with my first, I didn't have a birth plan together. I thought that having a midwife was my birth plan. That is not the case, especially with midwives these days. A lot of them they're not the historical midwife. They're very medically inclined midwives these days. So please know who your midwife is going to be. But my second midwife with my son, we had that information. I knew what doctor we were going to see or what hospital we were going to go to. We knew all of that information prior. So just make sure that you know, in case of emergencies, what doctor is going to be overseeing things what hospital you're going to, and make sure you feel comfort in that.
And have your like big yeses and nos on there. For example, when I was transferred to the hospital where I ended up having a C-section, they wanted to use forceps, and I was like barely conscious at that point. Like, things were not going well with me. Thankfully, baby was still doing great, but it was my husband that was like, no, we're not doing forceps. It's not happening. And then the alternative was the C-section, and then, that's what we ended up choosing. But if you have a strong desire, like we had a strong desire to not use forceps because we didn't like some of the outcomes that we had seen.
Absolutely.
Put it in there, because you never know if you're going to be in a place that you're just so out of it that you're not able to advocate for yourself. And that's when having it on a piece of paper is so important.
So yeah, let's add suction and forceps. That it doesn't happen as much these days, but it definitely can. So just make sure that's in your birth plan as well.
Mm-hmm.
All right, Laetitia, this was amazing. I'm so glad you came on and did this podcast episode with me. She truly is one of the most informed and medically educated women that I know. I'm so blessed to have you on the team. So
thank you. I really enjoy sharing, things that matter to me and researching things that matter to me with this amazing community of parents. So.
Yes, we have such a fantastic community of parents. And so we're going to put this information in the show notes in the VIP membership. So if you want to have all of this information, it will be in the show notes in the VIP membership. And that will be at drgreenmomvip.com. All right. So I hope you have a wonderful day, Laetitia. You all have a wonderful day out there. And I'll see you next time.
Bye. Thank you so much.
Yay.
I have so much more to talk about. So if you'd like to continue listening to this conversation, please join my VIP membership community. After signing up, you'll have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. Join my community at drgreenmomvip.com. Thank you for listening, and I'll see you next time.